Hello, everybody. Welcome back. We're going to be doing a StarGuard Lifeguard test review today. And I know you guys out there, you teens out there thinking about getting a job, probably thinking about getting a lifeguard job this summer. So here it is. Hello, everybody. Have you guys ever wanted to have a job? Thinking about having a job? Maybe right now you have a job, but you're still thinking about getting one, getting a better paying one. Thinking about being a lifeguard, maybe? It's an easy summer job. Sometimes it's not easy. The test for it's not hard. And maybe you're going through the lifeguard test and you're struggling. Well, if your lifeguard test is through StarGuard Elite program, I'm here to give you the crib notes and what you guys should study for with questions. And let's get straight into it. Starting off with, what are the steps for a primary assessment? A primary assessment is when you assess the scene, put on your gloves, you do 5 initial breaths, you check your consciousness of your patient, you say out loud or yell, "Unresponsive victim, I need backup, call 911, get me a backboard and an AED," and then you start on your rescue breathing. Again, you assess the scene, put on gloves, do your 5 initial breaths, check your consciousness, say, "Unresponsive victim, I need backup, call 911, get me a backboard and an AED," and then start your rescue breathing. What are the 5 STAR principles of being a lifeguard, or the 5 components of risk management? Number 1 is workplace expectations, prevention strategies, surveillance, response and rescue, and emergency care. Number 3, how do you check for consciousness? Hard hits on the shoulder, and then you ask, hey, are you okay? And if they don't respond, you start with your primary assessment. What are the 5 tips for effective teaching? Number 1, communicate effectively. Number 2, be safe. Number 3, have fun. Number 4, be prepared. And number 5, be patient.
So how many questions were there on the test?
The first one, there were 30.
And you have to score?
You have to get over an A. You have to get at least an A. So I think you have to miss, you can miss 6, which is, actually that's a B. So yeah, you have to get a B. For the second test, you have to get an A. I remember that. Because you can only miss 5, and it was a 75 question test.
Okay.
What does SAMPLE stand for? SAMPLE. S, symptoms. A, allergies. M, medications. P, past medical history. L, last oral intake. And E, what were the events leading up to this incident? Sample would be used when an incident happens, such as a kid's running around and he hits his head on the floor, or he's throwing up profusely, he went into shock, something detrimental happens. What does DOTS stand for in a secondary assessment? D, deformities. O, open injuries. T, tenderness. And S, swelling. If a person has a pulse and is still breathing but is unconscious, what do? You put them in recovery position. And how do you put someone in recovery position, you may ask? Well, we'll get to that. Don't worry. We're getting to that point. How do you start infant primary assessments and breathing and pulse? You put 2 fingers on the brachial, on the arm. You put your ear close to their mouth, feeling for warmth or breaths, and you look down for any chest movements with breaths. Or coughing or throwing up, whatever's happening. And a primary assessment, how do you check for pulse and breathing with a child and adult? You put 2 fingers on the carotid, neck, and then you put ear close to mouth, feeling for breath or warmth, and you look down for chest movements for 5 to 10 seconds.
On the victim's
Yes.
carotid.
Yes, not yours, because you wouldn't be helping anybody. I think you would know if you're alive or not. I'd hope. If a person has a pulse but is not breathing, what do? You perform your rescue breathing. And we went over our rescue breathing. How do you put a person in recovery position on the ground? So here you go, guys, if you guys are wondering. You lift your left arm up. So this is if they're laying flat on the ground. You lift their left arm up, put the right hand on the left shoulder, and then put your right knee up, and then put your right foot planted on the ground.
Okay, now, let's demonstrate that, putting your left arm up.
Let's do that. Yeah, that would make more sense. There we go.
That looks better.
And then you want to roll to your left side, and then this would have where this is like a wedge almost. Your elbow would act as a wedge.
That keeps the shoulder up as not a stop, so you can roll them and.
Yeah. And then you wait for EMS to show up. Yeah, I guess I probably should have had my left hand up. That would have made more sense. If a person has no pulse and is not breathing, what do? You start your CPR. CPR, you need to start your CPR if they have no pulse and no breathing. But what are the 5 reasons to stop CPR? Number 1, EMS takes over. Number 2, scene becomes unsafe. Number 3, the AED becomes available and ready. Number 4, you are too tired to continue and somebody would take over. Number 5, there are obvious signs of life. So for child and infant CPR, what is the ratio for breaths to compressions with 2 guards? This one got me on my test. It's 15 compressions to 2 breaths. So I gotta remember that one too. But the child and infant CPR ratio with 1 guard is 30 compressions with 2 breaths. Your adult CPR ratio is the same, 30 compressions to 2 breaths. So that's pretty nice. What does PPE stand for? You're gonna hear PPE all the time. You're gonna say, hey, your manager's gonna be like, hey, grab your PPE. You're gonna be like, what the heck is PPE? I'm here to tell you. PPE, pretty easy. It's your personal protective equipment. It's your gloves, it's your oxygen mask, it's your, maybe Band-Aids you have in your first aid pack. Who knows? In your fanny pack. How do you scan with sitting and standing? You do 5 minutes sitting, and you do 5 minutes standing, and you repeat until your rotation is over. What does RID stand for, and why does it happen? R stands for recognition, I stands for interference, and D stands for distraction. And this happens because if there is glare off the water, you recognize there's glare under the water, or on the water. It's an interference, and it is a distraction because you're trying to block it out of your face. You have your hand in your face, and you can't see. You have to move your hand all the time. It's a distraction. How long should it take to scan your entire zone? It should take 10 seconds. No matter how big, how small, how little your area is, it should take 10 seconds. If it's small, that's great. You're going to take a longer time scanning. Actually, that's not great. Don't listen to me. What does 3 whistle blows mean? It means you're activating your EAP. And what does EAP stand for? EAP stands for your Emergency Action Plan. You initiate your emergency action plan if somebody's drowning, if there's a passive drowner. Maybe I'm pretty sure because where I work as a lifeguard, if you do 2 initial blows for active drowner, not passive. 3 blows would be for a passive drowner. But this is for the StarGuard. So what does STAR stand for? STAAR. The S stands for scan, T target, A assess, A alert, and R rescue. What does RWI stand for? This is a big one on the test. They like talking about this. Recreational water illness. And what are some universal precautions? What is a universal precaution that the StarGuard Elite likes to talk about a lot? Which is a good practice, actually, very good practice. Act if everything is infected. Act as everything is infected. I like that a lot because water on the ground could be infected by bodily fluid that has dried up on the ground and it's come up. Who knows? Nobody knows. So act as if everything is infectious. What would you do for a spinal? Active and conscious. Ask them if they need help. If no, tell them to get out of the pool carefully and go to first aid. Which, I don't know, I'll be honest, I don't know if I really agree with that one. Because why are we telling a spinal to get out of the water? I don't think we should be doing that. I think we should be getting them backboard and getting them out. But other than that, they're active, they're conscious, they should be fine, really. It makes sense. When do you use FAST? F-A-S-T. If you think someone had a stroke, is when you use FAST. And FAST stands for F, face. Ask them to smile. A, arms. Close their arms. S, speech. Say a sentence. And T, time. EMS would want a time of illness. What does BPV stand for? Blood, poop, vomit. That's what BPV stands for. Blood, poop, vomit. Pretty easy. And what is surveillance? Surveillance is when somebody is actively scanning the water to see patrons in need of help. I think I'm pretty self-explanatory, guys. I don't know. What is prevention? Prevention is proactively stopping accidents, enforcing rules, and inspecting facilities. What do you do for an active spinal motion restriction? Have them put one arm around you, grab or head to assist them to first aid, and then call EMS. Grab arm or head to assist them. Yes. What is emergency care? Emergency care is providing CPR, AED, first aid, or oxygen. So that is emergency care. You're giving them emergency care because they're in need of it. Maybe they have hypoxia. Maybe they have something. What is response and rescue? This is going back to our 5 rules. At the very beginning. If you go back to the very beginning, we had 5 rules that we went over. Activating the EAP and executing physical rescue skills. SOP. What does SOP stand for? Standard operating procedure. What is our SOP? It depends on what pool you go to. This isn't just mainly for any pool specifically. This is for kind of a guideline. Manual for finding day, rotation schedules, and safety boundaries for pool. So you need to find those for your SOP. What is a good EAP? It's facility specific, really. But it depends on what the type of emergency specifications and heavily practiced during realistic scenes, during in-services, or anything like that. That's how you have a good EAP. What is the look for life rule? Safely assume they are drowning if they don't lift their head after a few seconds. Which a few seconds is probably 4 to 6. So, even though, because they could be playing hold their breath games, even though they're not supposed to at a pool. But it really depends on what pool, because some lifeguards are stricter than others. Drowning indicators. What are some drowning indicators? This one might be kind of obvious, but some maybe you don't know. So mouth and nose are covered by water. They can't breathe. They can't call for help, and they can't support themselves. What are some distress indicators? Mouth and nose above water and can breathe, can call for help, but is struggling to make forward progress. If you guys ever see somebody in the pool and they're just not moving at all, they're kicking as hard as they possibly can, but they just can't move, go ahead and maybe help them out a little bit, push them along, get them to the edge, tell them to monkey crawl on the edge all the way back down. What are some workplace expectations? You have professionalism, fitness, and your standard facility operations. Those are your workplace expectations. You're supposed to stay in fit, you're supposed to stay in check, stay in good body shape. It doesn't matter if you're fat or not, but it does matter that you can't sustain yourself in water, because that's the whole point of being a lifeguard. What is the drowning chain of survival? You are the absolute number one person you're supposed to save. And the length of submersion time is the most important. Going back to stool, what is cryptosporidium? Cryptosporidium is loose stool or diarrhea, and it is heavily and highly resistant to chlorine. It stays in the pool for 11 days. So if there's ever cryptosporidium in your pool, well, it'll be there for 11 more days. This is StarGuard specific. So what is the bleach mixture for bodily fluids? Actually, I think it's StarGuard specific, but it's 9 parts water to 1 part bleach. I'm pretty sure they're going off cups here, because when you say 9 parts, I would think, what's a part? But I'm pretty sure it's cups. So, what is the fluid contamination protocol? The fluid contamination protocol is blood or bodily fluid in a cut, in a hand, somewhere. Immediately wash that cut or your hands with soap and water, and you notify your supervisor. Any blood or bodily fluid. I heard a story that it was probably 2 or 3 years ago. Some guy got a cut on his hand, and he was probably helping a 6-year-old out. And this kid, he tested positive for HIV, and he didn't even know. And he was helping the kid out. He didn't have any gloves on. He had a little cut in between his fingers, and he got blood in there, and he's positive for HIV now. The guy that was saving the little kid. It sucks. Wear your gloves, guys. Wear your gloves. Make sure you're wearing gloves. No holds. What are the oxygen tank components? You have your regulator. You have your indicator gauge. You have your variable flow regulator. And what's your pre-attachment rule? You want to quickly open the oxygen tank so you can blow out any debris out of the oxygen tank, so you're not giving oxygen that has a whole bunch of dust and stuff to a guy that can't breathe. That would really suck. What is your AED protocol? You want to turn on your AED, apply pads, or here and here for a child. Here for an adult. Yeah. If AED delivers shock, resume compressions. But once AED says clear, make sure you yell clear, because sometimes people don't clear. They need to clear, it will kill them. Victim's chest. What happens if a victim's chest doesn't rise after the first rescue breath? Perform a retilt to the head, try your second breath. If not, begin your CPR. And what is agonal breathing? This goes back into the CPR. Agonal breathing is the ineffective gasping of breaths, and it's usually with an unresponsive victim. So if they can't take a breath in, that is agonal breathing. They need to be put on probably an oxygen tank, I believe, or Yeah. What is the primary objective of using oxygen? Getting oxygen into the victim's system will greatly help the survival of the victim. I mean, that's pretty obvious, I would think. But, yeah. Sometimes, I say it's pretty obvious, but shoot. I didn't pass my first time, and I'm going back for my second time, so this is why I'm helping all of you guys. Well, I'm learning too. Backboarding strap order. What is the backboard strap order? When securing a spinal victim to your backboard, you want to use your chest strap first, you want to do the rest of the body straps, and then you want to use your head immobilization blocks. Make sure you do your hair sweep if it's a girl or a guy with long hair. Hair sweep helps. What are the current/moving water spinal protocol? You want to position the victim where the current goes head to toe, so the victim isn't being sloshed around by the current and things like that. What is manual inline stabilization? Manual inline stabilization is the physical technique to not move the head, neck, and spine. So that is using the backboard, I believe. And what is the goal of extrication, guys? I think we can all say it with me. The goal of extrication is to minimize time to the first breath by getting them on the deck quickly. You want to save the victim as quickly as possible so they can, because if you have a victim that's unresponsive, you can start to have brain damage on that victim. And what is the definition of shallow water? Because you can have 2 feet of water with a 7-foot person, you'd say that's shallow. But you'd have a 2 feet of water and a 2-foot 3-inch person, and you say that's pretty deep for them. So it's chest deep or lower for that specific person. If it's chest deep or lower, it is shallow water. All right. What is passive SMR? Passive SMR is used on fully alert and responsive victims. Instruct them to have their eyes forward and don't move their head or body. Last one. What is active SMR? You want to hold their neck stable like a vice grip and keep them stable. Well, pause at any time, feel free, and I hope you guys pass your StarGuard Lifeguard test. And make sure to comment and subscribe. There may be more of this in the future, maybe with a Red Cross one, if I can, because I did have to verify with the Red Cross first. Or pass, doesn't matter. I hope you guys did like this video, and yeah, hope you guys pass your lifeguard test. Have fun out there.